Okay, you almost certainly have a box of this stuff in your kitchen right now. Baking soda, sodium bicarbonate. But here's the thing. Beyond keeping your fridge smelling fresh or making your cookies rise, this simple white powder has a secret identity. It's a powerful, high-stakes medication used in the most critical moments of life and death. I mean, just look at this contrast. It's pretty staggering, right? On one hand, you can stir a little bit into some water for simple heartburn. On the other, it's being pushed through an IV during a full-blown cardiac arrest. So how can one substance possibly bridge that huge gap between a minor tummy ache and a life-saving intervention? Well, that's exactly what we're going to break down. The secret to its incredible range isn't some super complex biological pathway. Nope, it's pure, elegant, fundamental chemistry. It all comes down to its amazing ability to act as the ultimate balancing agent inside the body. The key concept here is that sodium bicarbonate is what we call a buffer. So what's a buffer? Think of it like a chemical shock absorber. When things in your body start getting way too acidic, a buffer just steps in, soaks up all that excess acid, and keeps the whole system stable. It's basically the body's chemical peacekeeper. And the way it works is surprisingly simple. In step 1, the bicarbonate literally just mops up the excess acid, those little hydrogen ions, and turns them into a totally harmless, unstable thing called carbonic acid. But the body's not even done yet. In step 2, that carbonic acid breaks down into water and carbon dioxide. And how do you get rid of CO2? You just breathe it out. It's an incredibly efficient system for literally exhaling acid from your blood. So, with that chemistry in mind, let's take a look at where this simple buffer becomes an absolute hero in the hospital. We're talking about situations where its power to rebalance the body is truly a matter of life and death. We can pretty much group its major medical uses into 4 key areas. It's used for correcting dangerously acidic blood, for helping the body get rid of certain poisons, managing life-threatening potassium levels, and in some very specific cardiac emergencies. Let's dive into each one. Okay, first and foremost, its classic use is fighting something called metabolic acidosis. This is when the blood gets so acidic from stuff like sepsis or kidney failure that the whole body is on the verge of a total system shutdown. Giving IV sodium bicarbonate can pull that blood pH back up to a safer level and literally prevent a catastrophic cardiovascular collapse. It's a huge deal. Now, this next use is just incredibly clever. Let's say someone overdoses on a drug like aspirin. Doctors can actually use sodium bicarbonate to make the patient's urine more alkaline. This chemically traps the drug inside the kidneys so it can't get reabsorbed back into the body. Instead, it's forced out with the urine. It's like supercharging the body's own waste removal system. And its versatility is really on full display here. When potassium levels in the blood get dangerously high, that's a condition called hyperkalemia, it can trigger fatal heart rhythms. Sodium bicarbonate comes to the rescue by causing that extra potassium to shift out of the bloodstream and back into the body's cells, which helps restore a much safer balance and calms the heart down. But here's the pivot. This is so important. For all its life-saving power, this is a double-edged sword. Its ability to so profoundly change the body's chemistry is the very same thing that makes it incredibly dangerous if you get it wrong. So, where's the catch? What happens when you push this powerful tool just a little too far? Well, the risk isn't just one thing. It's a whole cascade of potential problems. Give too much, and you don't just fix the acid problem. You cause its exact opposite, alkalosis. The huge amount of sodium can totally overwhelm a patient with heart failure. And by shifting those electrolytes around, you can cause dangerously low levels of potassium or calcium, which can lead to muscle weakness, spasms, and even more heart rhythm problems. You can fix one problem while creating several new, equally dangerous ones. And this right here is why this is a prescription-only, highly controlled medication. You don't just guess. The IV dose is meticulously calculated with formulas just like this one, based on the patient's weight and really precise blood measurements. Believe me, this is not kitchen chemistry. This is high-stakes medical math where being precise is everything. So, what's the final takeaway from all this? It really all boils down to one critical message. This is a substance of profound power that absolutely demands profound respect. This quote from the medical literature just sums it up perfectly. Sodium bicarbonate is an indispensable tool, for sure, but it's one that can only be used safely with real expertise and extreme care. It's a pretty stark reminder that in medicine, sometimes the simplest substances hold the most complex power. And it kind of leaves you with a question, doesn't it? What other common things in our homes are hiding a secret, high-stakes life?